Hello, welcome to another edition of the Megacast. What in fact is a Megacast? Well, it's not a radio broadcast, that's part of it. Not just a television or a cable TV broadcast, that's part of it too. It's a little bit podcast, it's a little bit live streaming, it's a little bit radio, it's a little bit community television. It's all coming together to bring all of us together all across Oakland County to talk about COVID-19, the coronavirus, and a lot of other news that just happens to be popping up here today in our own backyard. Very good to have you with us. Dave Scott in our Lakes FM studios in West Bloomfield, and we thank you for joining us on 89.3 Lakes FM, 88.1 WBFH, The Biff, Ron Edibles and the guys, Ron Edibles? Ron Wittable. Now close. And the guys at the Biff, I'm going to hear about that. And WAHS 89.5 Avondale Community Radio. Thank you very much, Logan, getting us on the air at WAHS. Good to have Birmingham Area Municipal Access with us today. That is Channel 15 in Birmingham, Bingham Farms, Beverly Hills, and in Franklin. And thank you also for watching on Channel 15, Comcast in West Bloomfield, Orchard Lake, Kegel Harbor, and Sylvan Lake. That is Civic Center TV. You can go online today to civiccentertv.com, get all the information about the Megacast, and watch right now at civiccentertv.com. And a big nod today to the West Bloomfield Police Department and everyone there who put us on Facebook Live on the police department's Facebook page. So lots of places to watch, and it is important to watch, tune in, and stay with the program today because we have an awful lot to get through. Curt Lawson standing by, the Deputy Police Chief and Public Information Officer from West Bloomfield, will join us in just a couple of minutes. We're going to talk to a pediatrician in our area who says very, very important that vaccinations continue to happen. Now the doctor's offices are open. Restaurant and Lodging Association, we're going to talk to our friend John McNamara, VP of Government Affairs, in a little bit. Restaurants getting ready to open up on Monday. It'll be big news. And the tourism business is starting to thrive again here in Michigan. We're going to talk to the folks at the Auburn Hills Chamber of Commerce today, and then we're going to hear from Safe Salons of Michigan. And these people are frustrated right now because everything else is opening. Salons, spas, massage places, they are not opening. And then the governor kind of threw fuel in the fire there a little bit too with her comments, which we will share with you. And our own Erica Jones put together a really nice piece setting this whole thing up. We'll hear from her, and then we'll talk to Kevin Lent from the Safe Salons of Michigan. And then we got a couple of docs on the show today. Wow. Tyler Keefe, it is going to be a very busy broadcast.
Oh, there's a lot to go over. There's a lot to go over. A lot making news today. It's been a busy week, and it's a very busy day, probably the busiest of the week.
It is, and we're going to get to Curt Lawson here in just a couple of minutes. But as we get all that prepared, quick note on our headlines today. Governor Tyler says now it's okay to go visit people at the hospital, and that's going to be great news for people that have friends that are hospitalized that have not been able to get in and see them.
It is going to be big news for them. And we talked to Barb Giles yesterday about some of the pain of families that haven't been able to visit their families, particularly in nursing homes, unless they were on their way out, so to speak. And having people be able to go to the hospital and visit family that was there for a surgery or was there for an ailment, and they haven't seen them in a long time. They've been worried about them. That's absolutely huge.
Libraries are opening today. Big day. Libraries around our area are opening. We're going to try to check in with some of the libraries. If we don't get to them today, we will get to them tomorrow because we have a busy agenda today. Retail opening today. We're going to send our Erica Jones out to see how that's going. Last time we sent her out, Tyler, we sent her to 12 Oaks Mall, and it was a bust. There was just nobody there. But all the retail opens. That was when we were in the, you got to set an appointment, 10 people in the stores. Retail opens more completely today. It's been a long time. Sure, the malls are going to be open. We'll get to Erica a little bit, see how things are going in the field here in just a couple of minutes. The Detroit Zoo also reopens. That's great news. Been to the zoo in a while?
It's been a really long time since I've been there.
All right, well, the zoo is open with all of the safety and all of the guidance that we have. It's masks, it's wash your hands, it's keep your distance, all that stuff. Make sure you do all that. And then finally, more in the story that we talked about yesterday, Tyler. We'll get into it with Curt here in a minute. But it's kind of interesting. So the communities around our area and around the country have been putting in a lot of curfews, and then how they handle it and how they enforce it has been a challenge. Last night in Detroit, very significant size protest. Again, very peaceful, just wonderful. But the chief of police in Detroit decided not to enforce the curfew, and it seemed to have a very positive result last night, Tyler.
I think it was a great showing of we understand what you're protesting about. We're on your side in this, and we agree with you. And it's a nice show of solidarity between the police officers in Detroit and the protesters there, trying to peacefully speak out for a really good cause.
And speaking of wonderful, helpful, and intelligent police officers joining us right now, he's not going to blush, but is Curt Lawson, the Deputy Police Chief and Public Information Officer of the West Bloomfield Police Department. Curt, thank you very much for joining us today again on the Megacast.
Well, nice to be with you again, Dave, and nice to see you, Tyler.
Thank you.
It is good to have you. And, when this whole thing started, Curt Lawson, I didn't think we would be talking about these kind of issues here, but we are. So we'll get to the coronavirus stuff in a couple of minutes. To the issue that Tyler and I were talking about a minute ago, there have been a lot of protests, of course. More and more, they seem to be more peaceful protests, but communities have imposed these curfews. And then last night in Detroit, they've got the curfew, but law enforcement doesn't start arresting people, has been happening on previous nights. What are your thoughts about it? I mean, as a law enforcement official, how do you deal with a situation like that?
Well, I think you have to read the room. Certainly in Detroit, they've had a lot of protests pretty much every night. They had some protests that there's some individuals that infiltrated what was relatively a peaceful march and caused some violence. Some things were broken. And I think that's why they put that curfew or the option for the curfew into effect. And I think James Craig, the chief of the Detroit Police Department, he kind of read the room last night. It was a peaceful march, and I don't believe that he certainly didn't want to escalate things. So he decided to get out of his patrol car and to march with the protesters at the rally. And I think that was the correct decision. So, and he said, the curfew is kind of like another tool in our toolbox. And he felt, this rally is going well, and I'm going to get out and I'm going to show my solidarity with what they're trying to say and what they're trying to do. And I think that was the correct decision. And I think we've seen that in many cities where law enforcement has gone out. They have met with the protesters, they've met with the leaders, and they've tried to make that connection. And really what law enforcement needs to do right now is we need to listen. We need to show restraint, and we need to listen to the concerns of the protesters, because you know what? There's a lot that we can improve on in law enforcement, and that's how we're going to move forward, is by learning and improving what we do on a daily basis.
Curt Lawson is with us. He is the Deputy Police Chief and Public Information Officer in West Bloomfield Township, joining us today in the Megacast. And, Curt, it's complicated. I assume that when you were trained as an officer and as you try to impart your knowledge on those younger officers coming up through your department, you talk about how to make a decision in a matter like this, but reading to the book, the book that you must all have somewhere, in the book, in the police officer book, does it say part of your job is to interpret and decide when to enforce?
Atabsolutely. Discretion is a very important part in law enforcement, and that is why it's essential that police departments across the country, that they attract and retain the top 1 or 2% of the people that want to be police officers. You have got to hire police officers that are in it for the correct reason. They understand discretion, they understand restraint, they understand explicit bias. They understand that we want to de-escalate We don't always have to be the winners. We don't always have to charge in there. We have to kind of read the situation and be able to react. So we need smart, intelligent people. And, one of my concerns in law enforcement throughout this country is that the playing field is not the same. What we have, the product we have in West Bloomfield, which is a very, very high product, I think one of the best in Oakland County, that is not what you see nationwide. And I'd like to see the bar raised as far as education, training, more consistent training, and certainly better benefits and pay for police officers throughout the country.
Well, it goes without saying that it seems like police officers, all the first responders, teachers, they're not at the top of our pay scale here in the country, so that's good, and hopefully some of that will come out of this, and we'll end up with a lot of good, some new policies. We certainly have enough case studies over the past week of how to and how not to do things. I thought it was interesting last night watching the national news, seeing how they handled the curfew in New York. Very different situation than downtown Detroit, but they had a peaceful protest. But there they decided to very peacefully arrest some of the people that were violating the curfew. And it was one step certainly more aggressive than what was done in Detroit. But it wasn't done in a confrontational way. It was, the protesters kind of walked up very peacefully, allowed themselves to be cuffed. As we have seen at protests over my entire lifetime, part of the act of protesting and civil disobedience is actually getting arrested. So that can happen peacefully. Well, I see you're smiling, but doesn't that make sense?
Absolutely. And I think that's where we need to teach our officers. Let's have a little bit of a discussion and converse with the individual and let them know exactly what we want to do so there's no misunderstandings. Maybe this person wants to get arrested. Okay, so I'm going to explain to that individual exactly what's going to happen now. You're going to stand up. You're going to put your hands behind your back. I'm going to do this. Then we're going to do that. And just explain the situation. I think that brings down the tension, gets rid of that misunderstanding that might occur.
Curt Lawson joining us today. He is a deputy police chief and public information officer, West Bloomfield, joining us, and we appreciate talking to you again today, Curt. So we saw activity in Troy earlier this week, and I think the Troy Police Department handled the protest very, very well. There was an unfortunate incident there with a driver that drove right into the protesters and was immediately arrested. But other than that, police responded very well, taking a knee along with the protesters, and we've seen a lot of officers doing that all around the country. So I thought they handled that really well. But that was, I think, one of the earlier of many activities that are going on in virtually every community in the state of Michigan, and certainly all across Metro Detroit, including in all of the suburban communities. I don't know if you saw it in the news last night, Curt, but there was even a group of people, and it was almost all white suburbanite kids, but even like little kids, like I think they were like between 6 and 12 years old, walking through Grosse Pointe yesterday. So there's a variety of different activities going on, and they're all peaceful and they're all good. So, but that doesn't mean that some bad can't happen, and I know you got to be on guard, right, throughout all this, even though things are going in the right direction.
Absolutely, and I think that law enforcement, police departments within Oakland County are some of the best, and I think we're setting a great example, really, for the nation. Troy Police Department did a great job. They met with the leaders of the rally ahead of time. They set the ground rules. They fully understood what the rally leaders wanted to accomplish, where the march was going to start, where it was going to end. They had the proper security, but they had a fluid plan. So if things changed, which they did, they had an incident with a gentleman that struck an individual that was at the rally with his vehicle. They were able to handle that without things getting out of control. So you have to plan for multiple different situations, and because your goal at the end of the day is you want to keep the people that are protesting safe, you want to keep your team safe, and you want to keep the community safe. So if you can allow all that to happen and everyone can remain safe, then it's a win.
So, and to that end, I understand that there are additional rallies scheduled for this week, including one on Friday in West Bloomfield. What do you know about that? What can you tell us?
So there are multiple rallies throughout Oakland County. My understanding, there's 24 rallies within about a 72-hour period. So it's certainly going to put some strain on law enforcement within Oakland County. But we do have a rally here in West Bloomfield. I met with the rally leaders 2 days ago, myself and my staff. We were very impressed with their leadership and what they're trying to accomplish. And they want to have a peaceful rally right here in West Bloomfield. And they want to bring attention to police reform. And they made it very clear it's not about the West Bloomfield Police Department. They don't have any issues with us. Actually, they told us on several occasions they've heard nothing but great things about us, which I appreciated. And that just goes to the hard work over the past 25 years from the men and women within this police department. But their rally is going to be on Friday, this Friday, from 12:30 to 4. And they're going to begin this rally in the area of Maple and Orchard. So our residents should expect an increased level of law enforcement presence. But we totally expect this to be a peaceful rally.
All right. And I know that you're going to have plenty, as you already said, law enforcement presence, just in case, there are some other people that show up that have nothing to do with what the organizers are intending. So you're always on guard for that kind of thing. But we expect it's going to be a very peaceful day and a good opportunity to continue this national dialogue. You say did you say there are going to be 72 different events in our area? Did I mark that down correctly?
Well, I may have misspoke, but it's going to be 23 different events. 23 or 24 events within the 72-hour period. And just to be clear, we have spent the last 2 days late into the night planning for this rally to make sure that it's a safe rally. They're going to walk from Maple and Orchard down Orchard Lake northbound to the West Bloomfield Police Department, where they're going to be able to give speeches. They're going to be able to liaison with the chief and myself. And it's our goal is to meet them here and to listen to their concerns and have a great dialogue. And we're actually looking forward to it.
All right. Well, we will be there as well for our West Bloomfield listeners. We'll be there and cover as much live as we possibly can. And for folks around the rest of Oakland County who are tuning in, I'm sorry I got the numbers wrong. I knew I heard 72 in there somewhere. But 72 events, that would be a lot. 23 different activities. So Curt Lawson, Deputy Police Chief, Public Information Officer, West Bloomfield, it's got to be impacting a lot of other communities here in Oakland County.
Well, I think most law enforcement departments have upstaffed, so we're helping each other out. We certainly are going to have other communities on standby if we need some help. But, we have a pretty robust amount of individuals that work within our police department. So we believe we're going to be able to handle it. But certainly there's going to be some other law enforcement partners on standby if we need them. But we want to ensure the residents, our business owners, that we're going to be there. We're going to be there in force, but we're going to be with them. They're going to be marching, and we're going to be right alongside with them, and we're expecting this to be peaceful and no property damage or anything like that.
Do you expect that this is just going to be on Orchard Lake Road and they're going to make their way up Orchard Lake and Walnut during the middle of Friday afternoon traffic?
Well, certainly Orchard Lake Road traffic is a concern for us, and that's why we're going to have so many officers there. Because if they do wander out into the road, we certainly don't want anyone to get injured or hurt by a passing motorist. So if we have to shut down the road or we have to shut down an intersection, we certainly will push that information out to the public. That's my job and my team's job, and we will do that. We'll keep everyone informed. And certainly our business owners are more than welcome to contact me with any further questions.
All right, Curt. Well, thank you very much. I appreciate you sharing this with us and your thoughts and dialogue. And I just want to go back and just ask you one more comment. So I talked to
Sure.
Chief Mike Patton, the Chief of Police in West Bloomfield, and a lot of other law enforcement officials. We talked to the folks in Troy after their day on Monday. And, I think Chief Patton said it really well. He said that he was, after all this happened, he said, darn it all, Dave. He didn't say darn it all, but he said, I'm mad. He said, I'm mad, and I just have been asking every other law enforcement official I've talked to since that interview, does that best encapsulate your feelings as well.
Exactly. You know, the chief and I, we're very different people. We have a lot of different views on things, but we always kind of meet in the middle. But I'll tell you what, on this, 100%, we were both extremely angry. We were disappointed. We were saddened. We worked so very hard here at West Bloomfield to with our team to create what we've created, and it really undermines us in a lot of ways. And you know, as leaders, the chief and I, you know, we are committed to being part of the solution to this problem. And I have walked around this police department, have talked to all of our young officers, our men and women, but we're all on the same page. They're absolutely horrified by the incident that happened to Mr. Floyd, and it will never be, it never has been, and never will be acceptable here. Any sort of racial profiling, any sort of excessive force, and certainly if that did occur here, we would deal with it swiftly, quickly, and that person would no longer work here.
All right. Well, Curt, thank you very much. I appreciate your time today. We will be talking. And just one more time, I want to let you know and let everyone listening know that during this event, we will be broadcasting live. You and I will be in touch. If there's anything you want to share during the time, you got to get an announcement out to folks. We will be there, and we're going to do our very best to be out and hear the thoughts of those that are in West Bloomfield. Welcome everybody with open arms. And you know what? Darn it all, let's make this, there you go again, let's make this a really productive afternoon of learning and turn all of this crisis and tragedy into something good. Curt, thank you very much.
We certainly hope that these protests lead to some positive change, and we're glad to be a part of it.
Curt Lawson, thank you very much. He is the Deputy Police Chief and Public Information Officer of the West Bloomfield Police Department. We're going to take a break. We'll be back. It's a Megacast. Thank you for tuning in, not only in West Bloomfield, but all across Oakland County. The story that we're talking about in West Bloomfield is the same story we were talking about with the police folks yesterday in Rochester and in Troy, and when we talked to the Pontiac mayor and all across our areas. So thank you for tuning in. You're listening to the Megacast on 3 great radio stations, 89.3 WBLD Lakes FM, 88.1 WBFH The Biff in Bloomfield Hills, and WAHS 89.5 Avondale Community Radio. Thank you very much for watching today on Civic Center TV, Channel 15, and Birmingham Area Municipal Access, Channel 15, both on Comcast, on Channel 99 on AT&T. We also invite you to visit our Civic Center TV website at civiccentertv.com, where you can watch and listen to the show and find a tremendous amount of other useful information. Our own Erica Jones is standing by as retail opens up today. We'll get to her in a moment and talk to an area pediatrician who wants to make sure you're getting the vaccines for your kids. We'll be right back.
Hi, my name is Curt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Parks COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Tyler's just giving me a hard time because it took me 3 times to get the show on the air today. There's a lot of buttons, Tyler.
There are a lot of buttons.
He's just over there.
And in your defense, there is a lot to do with getting this on solo.
He's just over there. That facial expression was, I'm just saying. I'm just saying.
I don't make the rules. I just enforce them.
All right. Thank you for joining us, Dave Scott and Tyler Keep in our studios. And, hey, lo and behold, there she is, Erica Jones out in the field. And we're going to check in with Erica right now and see what's going on. Today, retail opens, Erica, and you were burdened with the terrible assignment of having to go shopping. How's it going?
Wonderful. I'm shopping. So I'm at DSW on 14 in Orchard Lake, and this was actually the only place in this whole strip mall area that was loud and proud announcing they're open. You can see they have these signs here. They're super excited to open. So let's go inside and pretend I haven't already been inside for 20 minutes.
Okay. You're not supposed to
So
tell
here
people
we
that.
are.
That's all right.
We're inside now, and as you can see, so they're open. Really exciting. A lot of people. Hi. So lots of shoes.
It does not appear that people are having a problem with social distancing right now, but I mean, for goodness sakes, it's early in the morning. Retail gets busy later on in the day, and they've not been open for a while.
I would never, being a shopper myself, I normally would never be here this early in the morning if I wasn't reporting. So people will definitely come as the day goes on, that's for sure. People are going to be very excited to
Erica, my question for you, and we won't keep you too long, but my question for you is it like a normal shopping day, other than there aren't a lot of people there? Does it look like your normal shopping day, everything's stocked up,
Absolutely.
the people are there, and nothing else really special going on?
Yeah, I mean, if anything, they have more stock because, people haven't been here buying stuff, and very much a normal shopping day. They have announcements playing periodically saying, make sure you're social distancing. They're only taking credit card payments, no cash. But other than that.
All right. Well, it is back. Ladies and gentlemen, we are reporting live from the field, and it is officially back. Retail has returned. Tyler, do you have any additional comments?
No, I think that pretty much covers it. It looks like they have definitely the measures in place. We see the arrows on the ground for one-way aisles and so on, like you see in the grocery stores all around. And
sure,
people seem to be following those pretty well so far. And interesting that they're not taking cash, as they continue to not want to transmit those fomites we talk about every day on the COVID vocabulary. So.
Yeah, there are fomites all over every dollar bill, or worse. So, I mean, yeah, exactly. Erica, anything else in the field?
No, not much. People they seem excited to be here, the few people that are here. And I definitely think, hopefully, this will be a safe and good way to continue moving forward through this pandemic.
What is not open today are salons, and you can't get your hair cut, you can't get your nails done, you can't get a massage or other beauty treatments, and I know that a lot of people in Michigan are really upset about that. Governor made some controversial comments earlier in the week, and you've prepared a report, which we're going to see later on in the show. Do you want anything you want to let people know about what they're going to see later on today in the program?
I have a newfound respect for salon owners. They are so passionate about what they do, and they are angry. So brace yourselves. They are not taking this lightly. They are, infuriated by this situation, and they just feel disrespected and belittled by some of these comments that were made.
All right, well, we will hear the comments of the governors that were probably not her best chosen words throughout this whole matter, and we're going to hear from their industry in a group called Safe Salons of Michigan Coalition coming up later on today. Thank you, Erica. Appreciate it. And our own Eric Jones checking in from the DSW store where Tyler, I need to go. These shoes are a mess. Yeah. They are a mess. So we got some shopping of our own to do. We're going to take a break. We'll be right back. Your kids, they need to get their vaccines, and it's been very difficult to get that done. Maybe you, too. It's been very difficult to get that done over the past couple of months. We're going to talk to an area pediatrician and get an update on that in just a moment. It's the Megacast. Dave Scott, Tyler Keefe, and we will be back in just a moment.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, If you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Coronavirus has put us to the test. Now it's time to put it to the test. We've greatly expanded testing in Michigan. So people who think they may have COVID-19 with symptoms like fever, cough, and shortness of breath can get tested. And those without symptoms who work in public can now get tested, as they could carry the virus. Start by calling your healthcare provider or contacting a testing site near you. Learn more at michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Welcome back to the Megacast on 89.3 Lakes FM in West Bloomfield, 88.1 WBFH The Biff in Bloomfield Hills, 89.5 Avondale Community Radio in Auburn Hills. We're on a couple of community TV stations as well in Birmingham, West Bloomfield, and points beyond. And we invite you to tune in today via Facebook Live. We have a different Facebook Live partner from across our area every single day. And today it happens to be the West Bloomfield Police Department. So we salute our first responders and thank them for providing some additional coverage of the show on Facebook. So just a couple of announcements regarding the show. First of all, Tyler, on Monday, I will be eating breakfast while you're doing all the work. Restaurants open back up on Monday, and we are going to be at the Grill in Sylvan Lake broadcasting live. Is that correct?
That is correct, yes.
All
we'll
right.
have that happen on Monday. We're in the process of getting that all planned.
Yes, we need to dust off all of our remote broadcast equipment, make sure we can do that. So we'll be there Monday. If you're in the area, feel free to stop by. Again, it's the Grill in Sylvan Lake. And then, as you heard Curt Lawson speaking just a couple of moments ago, there is a planned protest in West Bloomfield on Friday, so we will have extensive wall-to-wall coverage all day for our West Bloomfield listeners after the Megacast tomorrow. So stay tuned for all that. We met Dr. David Obudzinski by reading an article in the Detroit News talking about the concern of a lack of well-child visits to pediatricians during the pandemic. This has become especially concerning because of child vaccination numbers are way down, and we are delighted now to be joined by the doctor. He is from Beverly Hills Pediatrics. Dr. David Obudzinski joining us on the Megacast. Doctor, welcome to the show.
Thank you.
Well, thank you for being with us. So really, for the most part, most physicians have been doing telemedicine and asking people to stay at home for the past couple of months. Now we're getting back into offices, and that's good news. But what impact has this had on the pediatric community?
Well, we've seen a lot less children come in for their well visits over the past 3 months, especially when the pandemic started. So we had less children who were getting immunized at the regular routine well visits. And I'm worried about the infants, especially because those infants receive a lot of vaccines in the first 2 years of life. And so missing a visit means missing some of their vaccines that are important for them to be protected from certain diseases. And I think it's important that they come back in and they start scheduling their visits and get back to their immunizations that they need to have so they can be up to date. It was really tough at first. We were seeing a lot of parents who were very nervous, scared, justly so, about coming in. We tried to do what we could at the office, ensuring that we had separate times for sick visits and well visits. We try to also have increased amount of cleaning of the waiting rooms, try to keep people out of the waiting rooms actually in their cars until they, have rooms open. But it still didn't make a difference as far as people were nervous about coming in. We didn't really see a lot of children with, COVID-19. So we were seeing just regular routine visits in our office. So, but of course, I know the concern is that it's out there and parents who are worried about that.
Well, and this is in a climate, and correct me if I'm wrong, Doctor, but this is in a climate where we already are concerned, maybe not locally so much, but globally, about the routine vaccinations that we've been so good at as a community getting done. We have seen some erosion, if you will, in the numbers of folks getting their routine vaccines. Is that a correct assessment?
I think that there has been some, but in our population, the patients, there hasn't been a lot prior to the pandemic. So, there would, I would say, been a great reduction with the pandemic, just because of, again, because of the fear of people not wanting to bring their children in. So,
Dr. David Obudzinski joining us. He is a pediatrician at Beverly Hills Pediatrics, and we thank him for tuning in. Beverly Hills, of course, one of the communities we serve through Birmingham Area Municipal Access. So if you are in the area and you've not had your children in for their vaccinations and other just general checkups, do so. Beginning to see some reports, Doctor, and maybe this gets a little bit out of your pediatric expertise and just would enjoy your general medical knowledge here, but we're beginning to see some reports, and I believe I saw an article in one of the Detroit papers today about some of the other side effects, if you will, or negative health results that have happened to people that have had a pretty severe round of the COVID-19 virus. And, there's still a lot we don't know, don't you think, Doctor, about the impact of this disease?
I think we're still learning things all the time. Not as it was in the first part of the pandemic, where we're learning things daily. Now we still are learning things each week, about the COVID-19 virus itself. So I think that it's still not fully understood, the virus itself. But I think we have a better understanding, certainly, than we did 3 months ago. And I think that there's questions to be answered, especially as we move forward, as to whether or not, people who've had it, are they protected then? Will they have, adequate protection to be safe in the fall, should there be another outbreak, which we anticipate there would be. Then we know that kids in general still have less intense disease. I mean, it's something that we still are seeing. There has been this multi-system inflammatory syndrome that's been described in children, and it seemed like there were a lot of numbers, but we didn't really test, and we haven't really tested children overall for COVID-19. So we don't know out of how many kids who actually came down with it, how many had this inflammatory response. And it's been a response that's been treatable, which is good, as long as one realizes what's going on with the children.
Dr. David Obudzinski joining us. He is a pediatrician at Beverly Hills Pediatrics, and we appreciate him joining us today on the Megacast. Doctor, I think it's safe to say that your kids are certainly not insulated from all this. Initially, we thought this is only going to be affecting COVID-19, that is only affecting the most aged and those with dangerous medical conditions, but we've seen there's other widespread impacts. And this all happens at a time, the most information that we have came at a time when our children were out of school, and most of them were at home. So as we come back into the fall, schools are open. I think it's safe to say that parents really need to be on guard to make sure that the kids are doing the same thing that everybody else is doing to stop the spread of COVID-19, because we just don't know. We don't know exactly what impact it may have, and you're not automatically immune if you're under 18. So I believe we've lost our...
I think that also...
There we go. Go ahead, Doctor. Your internet connection's in and out a little bit. We'll see if we can get a final comment from you. Go ahead. All right. Well, unfortunately,
Okay.
99 out of 100
with-
times this has been working really good, but his internet signal is in and out. We'll talk to the doctor again in another date, but I really appreciate him joining us. And needless to say, Tyler, if you've got some youngsters around your home, be careful. Be careful because COVID-19 and some of these other related diseases could impact them, especially as kids get out more throughout the community.
Yeah, especially in the fall with schools opening, but also now with day camps being reopened and public swimming pools being reopened and retail and restaurants as well. They're going to be out in the public more than they have been being stuck at home mostly, and there's going to be more exposure. So taking them in for those regular checkups and making sure that they get, especially those young infants 2 years of age and younger, as the doctor had said, get their vaccines is going to be critical.
And as a reminder, again, for everybody, doctors' offices are open now, so there's no reason why you cannot get in and see your local physician, pediatrician, whatever other specialist you need to see. If you've not gone out and done that the past couple of months, we urge you to go out and do that. Quick look at the headlines, and then we're going to talk to John McNamara, Vice President, Government Affairs of the Michigan Restaurant and Lodging Association. Restaurants open up on Monday. Hey, Tyler, do you think that John knows yet about the what was the drink we came up with yesterday?
Quarantini.
The quarantini, yes. I
Sure
noticed that's not on my vocabulary list today.
I missed that.
All right, but we got to see if he knows about this new drink we invented on the show. Actually, the people at one of our restaurants invented on the show yesterday. But we'll talk to him. Restaurants have to be thrilled. We're seeing indications that we may have, in fact, more of the tourist business begin to pop up here around Michigan. We'll get an update on that. Restaurants are happy. Salons are not. Later on in the show, we talk to Kevin Lent of Safe Salons of Michigan Coalition. They're really not. They're about as happy as the landscapers were a couple of months ago. Remember that? They're about as happy as the golfers were a couple of months ago. So we're going to talk to them coming up in just a couple of minutes. Don't go away. It's the Megacast. We'll be back in just a moment.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. Please stay home, and when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
Technology like smartphones are wonderful devices to reduce social isolation in older adults. You can call grandchildren, phone friends, participate in fitness classes, and play games. But you need to stay mindful of scams. Scams related to the COVID-19 virus are rising. These include attempts to obtain personal information from seniors, including pitching unreliable products, advice, tests, and cures. You need to stay vigilant and be cautious. If you feel that you have been taken advantage of, it's okay for you to reach out to somebody you know and seek out advice, or even contact your medical provider. Thank you.
Welcome back to Oakland County's source of information for everything COVID-19 and now beyond. 89.3 Lakes FM, 88.1 WBFH The Biff, 89.5 Avondale Community Radio. Thank you for tuning in to Civic Center TV, West Bloomfield, Orchard Lake, Eagle Harbor, Sylvan Lake, Birmingham Area Municipal Access, Birmingham, Bingham Farms, Beverly Hills, Franklin, and CivicCenterTV.com. Everything online you need during these trying times. Joining us now from the Michigan Restaurant and Lodging Association is John McNamara, Vice President of Government Affairs. John, welcome back to the Megacast. Good to have you with us.
Good to be here again. Thanks for having me.
Well, it's a happy day, almost. We are going to get those restaurants open on Monday. And I just want you to know that after talking to the folks at the Harbor Steakhouse in Keagle Harbor, they have put together a cocktail that we can celebrate the occasion with. It is called the Quarantini. I assume it is a variation of a martini. And, I don't encourage our audience to go out and get drunk on Monday, but I think there'll probably be a person or two around the state of Michigan that might tip a glass in honor of this auspicious occasion.
I can tell you I'll be one of them. So absolutely, we want everyone to get out there and, continue to be safe and be responsible.
All right, John. So tell me your thoughts as we're getting ready to open up.
So obviously, this is something our members have been getting ready for and have wanted for a while. So I think you're going to see a vast majority open Monday and open responsibly. We've had a number of members who have already had staff trainings and have gone out and redone their layout so tables can be 6 feet apart. But I think you're also going to see some who maybe don't open for a few days. There are some supply chain concerns. And then everyone just really wants to make sure that their staff, knows the new processes, knows the new procedures, and they can open safely so they can take care of their guests.
I think the last time I talked to you was right as we were getting ready to open things up in northern Michigan. And I went up and we reported live from Charlevoix on the day the restaurants opened up there. And what we saw there was an increased number of restaurants with outdoor seating. We did not see the heavy concentration of people that we thought. And I'll tell you, the employees up there did an amazing job. They're all wearing their masks, helping out patrons. In fact, at the establishment that I was in, the Villager Pub in Charlevoix, even the bartender there was wearing a heavy-duty face shield with a hardcore PPE. So I think from my observation, the patrons and the folks in our restaurants in northern Michigan did a good job. Did you see the same thing? And was that partially why we were able to get things open down here?
I think absolutely yes. And we did. We heard great reports from northern Michigan. Obviously, you had a few people who didn't follow some rules, but you're going to have that when you have mass gatherings of people no matter what. But for the most part, our colleagues in northern Michigan and their staffs all did their jobs. Everyone went out, but they went out safely. So I think that proved that this industry has that ability and can do it. And then obviously, we'll be open up Monday statewide. And I think you will see an increase in outdoor space. And I want to thank the governor's office and the Liquor Control Commission for having restaurants be able to expedite that process. It used to be pretty lengthy, but there's now about a 2-page form online where they can fill out and then they can expand outdoors very quickly.
Well, one of the things we saw in Charlevoix is the city had blocked off the parking on one side of the street.
Yep.
I think that was just to lower density, but it also was to make it easier for the establishments to move out onto the sidewalk in that community. And we talked to the city manager in Birmingham just a couple of days ago. And Birmingham is encouraging, and I think they are in Rochester, where we talked to the folks there in the police department earlier this week. These downtowns, I think like Milford and Northville and Rochester and Ferndale and Royal Oak and Birmingham, these downtowns that we love to go to have a dinner or a drink after work are just great places to get together. And I had no idea the LCC had made this easier, but we are going to be seeing a lot of places opening up on the sidewalk almost right away. Are we going to see that on Monday, or is that going to take a little bit more time to implement?
No, I think you'll see that a lot on Monday, and you'll also, I think, some spill out into if there's a public park or some public space nearby, some spill out to there. So you're going to see a lot of different creative solutions here over these next couple of weeks that, allow for them to open, but still allow for things like social distancing. And, it's obviously this is why we live in Michigan, because of the summers. And so it's so beautiful. So people want to be outside right now. And luckily they have that ability to expand to allow people to outside. We're also seeing Traverse City has shut down a few blocks of Front Street. So I think you're going to be seeing more of that as well moving forward.
John McNamara is the Vice President of Government Affairs, Michigan Restaurant and Lodging Association, joining us today. And then there's always some fun things that you see. I mentioned the Quarantini earlier, but we also talked to another establishment. In fact, Monday morning I'll be broadcasting live from the Grill in Sylvan Lake and having breakfast there live on the radio as they open up. And they actually came up with a really interesting idea I'd like to share with you, John. They have a thing they call the COVID Monster. And what the COVID monster is a very intimidating stuffed animal they're going to put on the tables where you're not allowed to sit. So restaurants have to come up with ideas. I thought that was a cute one. What do you think?
I like it. We're also seeing very common of restaurants, instead of removing tables and, maybe putting them in the back or putting them off site, just putting table tents on there that say, not able to sit here, or this table is not available. But then if they need to move quickly, instead of moving tables, they can just move table tents that, it's obviously much easier to move that. We're also seeing people put a QR code on the table tent, so you can have a contactless menu right there. And, right now we're seeing a lot of people either throw the menu out or, wipe it down, but that's just one other way where you can sort of remove a step and everyone can take out their phone and take care of it.
Well, feel free to share the idea of the COVID monster around the state of Michigan. I thought that was a really creative idea. I'll get a picture, if you don't mind, on Monday, or maybe you can watch a Megacast and you can see it for yourself. But we're going to talk later on in the show to Kevin Lent, and weigh in or not if you want to here. But he is with Safe Salons Michigan Coalition, and the salons now are where you were a couple of weeks ago. They're very, very frustrated. We got a piece coming up on that our Eric Jones put together. But what would you say to the hairdressers and the barbershops and the salons and nail salons around the state?
I can't wait for you to open, because as it's apparent, I'm in desperate need of a haircut. But we think you should be able to open. We understand how you feel. You can do this safely. You're well trained. Your staffs are well trained. You have the ability to do this. And if I can go to the dentist right now and that doctor can literally put their hands in my mouth, I don't know why someone can't cut my hair. So we think they should be open just like we are. And we feel for them, and we hope that they're open very soon in the near future.
Your hair looks a lot better than mine right now. It's taken about a pound of gel to get it under control every day. So, very good. John, anything else you want to add before we say so long?
I would just say, two pieces of legislation moving. One would allow for cocktails to go, and then the other would allow for some social districts where essentially local municipalities could create a common area, and you could go to a bar or restaurant, grab a drink, and sort of walk around your downtown in that designated area with a beverage. So 2 tools moving forward we're excited about for our members and for anyone in the state to be able to utilize.
All right, now you brought that up. I got to ask. So
sure.
Cocktails to go. You mean you could go to a bar or restaurant, fill up a glass with a drink, and walk out the door with it?
So sort of. You could do that in a social zone. So if that bar or restaurant is in a designated area, you could do that. Cocktails to go would be more if you're going to your local Mexican restaurant and picking up tacos or enchiladas. They could also sell you a gallon of margaritas sealed to go, and you could take that with you. Or if there's a really great Moscow Mule in your town and you're having people over for dinner but don't want to deal with making craft cocktails, you could go buy a 6-pack of craft cocktails at your local bar and then take it back to your house and enjoy it.
I like it. It's a margarita growler. I mean, that sounds like,
yes.
It's exactly what it is. So you're saying that, maybe in Birmingham, for example, that there may be an establishment that's close to a park or a parking lot or some other area that they can control, and we may actually be able to serve there at those locations, and that's what we're working on.
That's what we're working on, and it's all the locals are at the table, so the locals would decide the breadth of the zone and specifically how far it can go and where you can go. But this is a way if people don't feel comfortable sitting down, but they can still get a drink and walk around and be outside, but be 6 feet apart.
For you people and your members, it's a win. I think maybe you deserve one right now, but this is probably something that you might have been thinking about asking for a long time, but it is the right climate for it right now.
It is, absolutely.
All right. Well, good luck. Listen, folks, don't be stupid. Be careful with these new privileges as they start to happen. But I think it's a great idea. I just love going to these outdoor restaurants here in Michigan, maybe by a lake or by a really picturesque area. We have so many different opportunities. Our downtowns are great places for this. I mean, that's what summer is all. Our summer is so short here. What a great way to enjoy it and be a little bit safer. So, John, thanks for bringing that up. We'll keep an eye on it. And again, now most of that is approved. Some of that is still working through the legislature, and local communities have the right to say thumbs up or thumbs down, right?
They do, absolutely.
Are most of them saying thumbs up, or don't we know yet?
We have probably 5 or 6 communities whose city councils have already taken action to implement this. So far we're seeing it as something the locals want, and they're doing it their way and controlling it their way.
Are any in our backyard, any communities that have said yes in Metro Detroit?
Birmingham is working on it. The city of Detroit has said yes so far, and then we know others are working on it.
Sounds to me like something Royal Oak and Ferndale, and
I think you'll see Royal Oak in both of those pretty quickly.
I mean, imagine the fact of going to Royal Oak or Ferndale and having a drink. It seems like such a foreign concept to me, but I don't expect it.
If Arts Meets and Eats happens, but it'd be a big thing for that.
Oh man, it'd be great. All right, John, thank you very much. Good to talk to you again. Look forward to doing this in person sometime soon.
Absolutely. Thank you.
All right, John McNamara, he is the Vice President of Government Affairs, Michigan Restaurant and Lodging Association. We appreciate him being with us. We're going to take a quick break. We'll be back. Megacast continues in just a moment.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/contain-COVID. A message from the Michigan Department of Health and Human Services.
Well, we've been doing this for a couple of months now and a little bit more, talking to you about and talking with you and getting together as communities, talking about the challenges we have all faced during the outbreak of COVID-19 here in Michigan. But we have flattened the curve, no question about it. And it's summertime, and this COVID thing, doesn't seem to want to stick around in the summer. So, and it also doesn't want to stick around if you show up with a mask on. It doesn't. You show up with a mask, Tyler, and you're a masked invader into the world of COVID-19. COVID-19 is scared. It is not going to mess with that. So that's all. Excuse the drama. It's all good. So we're making a lot of progress. Businesses are starting to open up. I think we might actually have a summer here in Michigan. Michigan State, your alma mater, even since kids are coming back to school, and we haven't gotten the official word from Maize and Blue Land, but all indications are they will be doing the same. So we are marching in the right direction. Good news. We are keeping an eye on a number of stories today. While so much is opening up here in the state of Michigan, the salons are not opening up right away, and a lot of people are frustrated. And, I'm not one to pick on the governor. I have not. I will not. But I don't think she had her best day a couple of days ago talking about this issue, and it kind of threw salt into the wound. You'll hear her comments and hear from Safe Salons of Michigan, and you're going to actually hear from a number of salon owners in the next couple of minutes, and a really fine package put together by our Erica Jones. So we'll check in on that in just a minute. But Darn it all, it's a pretty good day. Retail is opening up today in the state of Michigan. Libraries are opening up today in the state of Michigan, and restaurants and other establishments open up on Monday, and that's got to make Jean Jernigan very happy. She is the president of the Auburn Hills Chamber of Commerce. And Jean, hello, and welcome to the Megacast.
Hi, Dave. Hi, Tyler.
Hello.
So thank you.
Virtually meet you.
Yes.
Look how good you look on Zoom there. I like that. You got your Auburn Hills sign. You're smiling. You're happy. And hey, why not? We're on the road to getting our businesses open, and that's got to make any chamber director feel real good.
Absolutely. After 12 weeks of being locked down for the most part, makes a big difference for sure. We're happy to see everybody opening back up finally.
So we were just talking to John McNamara of the Michigan Restaurant and Lodging Association. You might have heard John in there. And a lot of creative things happening as the restaurants begin to open, and communities will have the opportunity to allow restaurants and bars to expand their reach a little bit around their property. Do you see that kind of thing happening in your community, or is at least there dialogue about that?
Oh, yes. So, one of the cool things about Auburn Hills, we have a really unique makeup as far as the city proper goes. So we house Great Lakes Crossing outlets, one of the largest tourist attractions in Michigan, as well as the only Topgolf in the state. And then we also have a very nice, quaint, beautiful downtown area as well. So you've got a lot of different aspects going on with our city proper, and talking about the reopen of some of these different districts or areas within the city of Auburn Hills. So Great Lakes Crossing obviously has reopened, and they are experiencing limited hours right now, but I am thrilled to say, have more than 36 stores that have reopened. And on their website, you can see which stores are available, and then you can also see the hours of their availability as well. So,
hey, Jean, maybe can I make an offer and impose on you a little bit? You can't say no because we're live on the radio and TV right now. But what if we send out Erica Jones maybe someday next week or whenever you think it is appropriate with our cameras, and we just do a live report from Great Lakes Crossings. You can come with us if you want, and maybe walk us around the mall a little bit, see how things are going out there, and maybe give a good opportunity to promote to all of Oakland County what's been going on there and how folks in Auburn Hills and the mall are dealing with this. Would you be up for a little walkabout out there at Great Lakes Crossings?
I'm all in. Absolutely.
All right.
Yeah, that'd be great. I'll let Gary and Dana and Kristen, the management team over there, we'll just plan the whole thing. Yeah.
Are they going to be able to do some things outside of the mall? Are the malls working on that, or they have their hands full just getting things back up and operating? Because that is a great mall. It's one of the best malls in the country, and right here in our listening area.
Yeah, they are definitely working towards figuring out how they can do that. And of course, there are some restaurants that already have that opportunity. And so there are some capacities and capabilities to make that happen. Prior to this, the mall itself, they have such a massive parking lot. So there's a lot of opportunities for outdoor activity as well and outdoor events. So just throwing some of those ideas out there as far as for creative ways that people can take advantage of some outdoor social distancing, so to speak. So.
Well, we all got to pivot and figure out how to get through this crazy thing, and I think everybody by and large has done a good job. But let's not miss the fact that these businesses have been closed down for an awful long time, and they're Tyler, what's the name of the place you probably go there that sells the crack fries? Hopcat, forgive me. Hopcat registered yesterday. I think they filed for bankruptcy. And they're just a great Michigan company with fantastic restaurants. So it's been really hard. It has been a difficult time, don't you think?
For sure, I do. I totally agree. We, along with obviously our large mall that we've talked about so far, we have a number of small businesses. And our downtown is full of those small business owners. And, we've heard from so many of them and have worked with them through this process and trying to make sure we serve as a resource, to one, get all of them the right equipment that they're going to need to open from a PPE perspective, but then at the same time, just with their needs and it is devastating, obviously, as all of our small businesses have experienced. But at the same time, one of the things I'll mention that John was just talking about too, that the Auburn Hills community and the DDA and our TIFA are working very quickly to allow for the changes that need to be made. We have what's called a pop-up public square that they're setting up outside, and there's a beautiful park where there will be opportunities to grab and go, so to speak. And so that's already been approved in our area. We also have in the past and are planning to, again, moving forward, as he mentioned, with the, the cocktails to go. So prepackaged beer and wine right now would be approved, that you can take it. And we have a couple of businesses just in our downtown that do tasting, and then you can purchase beer and wine and take it with you. So this would provide an opportunity for people to do that and then just go and sit and socialize from a obviously social gathering and social distancing perspective, but to have a nice time and enjoy themselves.
I don't want people to think that I'm a drunk, but, McNamara just said on the show, he said that they're trying to do that for liquor, too. So, maybe you could have a margarita growler. When we can have a margarita growler in the state of Michigan, I'm going to send the governor a thank you note. I'm just saying.
I will sign that thank you note too.
I'm just saying. Hey, I just want to mention to you, just as you talk to your establishments in Auburn Hills, I just got to salute the people at the Harbor Steakhouse in Kego Harbor, because they came up with a really good drink that you might want to tell people to start serving up around Auburn Hills. It's called the Quarantini. So so I don't know what's in it. Tyler, do we know what's in the Quarantini? No.
No, as I've said before.
He wouldn't have one anyway. He's such a good kid. But I would.
Safe answer, Tyler.
No, Tyler would have one. So but when we get together, we'll have to have a Quarantini. Anything else? Anything else that you think might be helpful for our folks, Gene?
The one thing I'll mention too, obviously, I just had a conversation this morning with the general manager of Topgolf, and he actually right now is down in Indiana working at the Topgolf down there to learn the nuances of reopening, so that when they officially do reopen up here, they will be able to do that confidently. And a couple of things that he mentioned, they're set up perfectly for a situation that you can actually be outdoors, and they have different bays obviously set up so you can, and he said, up to 6 people. Each bay allows a barrier. They have a barrier set up, and you're at least 11 feet apart. So again, I think that it's a great opportunity moving forward in the coming months for families to be able to get out and enjoy some time and have some fun and really experience, the great Michigan weather. So, and along with that, one of the other things too, I just want to give a shout out to many of our manufacturers in the area of Auburn Hills. We have a large manufacturing, international, global manufacturing makeup, so to speak. Mm-hmm. And they all were so proactive in reaching out and helping to provide PPE equipment to our hospitals and our frontline workers and our police, fire, and safety, and have done just such an amazing job, really uniting together to be proactive in helping the community. So.
Well, Gene Jernigan, the president of the Auburn Hills Chamber, we've talked to a ton of them throughout this whole time, Gene, and you're right. There have been some great stories, PPE this, solutions for that, helping with the whole manufacturing chain on a variety of different things, including ventilators. So much happened right in your community and here in Auburn Hills to help us get through this crisis. So it is a really good time. So we're going to keep in touch with you. I think, Tyler, our bigger job through this whole process may be publicizing and sharing information about all the new things that are going to be available and encouraging people to get back out. So we're going to focus on that, Gene, if you don't mind. And you mentioned Top Golf a couple of minutes ago. I love that place. And I've not even been there, but all we've heard about it. I mean, for people that don't know about Top Golf, I tell people, just imagine you're at Comerica Park watching a baseball game and you happen to get tickets to the executive suite from the boss, and then you brought your golf clubs, a bunch of balls, and a tee, and you can hit balls out to third base. That's kind of what. Is that a pretty good description of what Top Golf is?
It's a good description. Yeah, for sure.
She's being very charitable with me, Tyler.
Well, you don't have to be a golfer. That's the great thing. And you don't have to bring clubs or balls or tees or anything. Basically, you just show up, have a great time. They provide you with all the necessities, and whether you're a golfer or not, you can enjoy it.
It looks like a lot of fun when you drive by it on I-75, and you can see everything they've done there. So really cool. Good to have it in our county and in your community. Gene, thank you very much. I really appreciate it. Look forward to seeing you soon, all right?
Thank you. Thank you for your time.
Jean Jernigan, she is the president of the Auburn Hills Chamber, joining us here in the Megacast. When we return, there is one group of people that are not really very happy right now, and that is our salons, our hairdressers, our barbershops around the state of Michigan. They are among the last to be able to open up. Our own Erica Jones is out in the streets now, and she's been working really hard to get us all the update information on how those owners feel. She's got a comprehensive report coming up, and then we'll talk to Kevin Lent. He is with Safe Salons of Michigan Coalition, and we'll talk about the challenges that these salons and establishments are having when we return.
Coronavirus has put us to the test. Now it's time to put it to the test. We've greatly expanded testing in Michigan. So people who think they may have COVID-19 with symptoms like fever, cough, and shortness of breath can get tested. And those without symptoms who work in public can now get tested, as they could carry the virus. Start by calling your healthcare provider or contacting a testing site near you. Learn more at michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Hi, I'm Dr. Jonae Caldoon. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
Hi, my name is Curt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Welcome back to the Megacast on 89.3 Lakes FM in West Bloomfield and Commerce Township and Farmington Hills, 88.1 WBFH, the Biff in Bloomfield Hills, Kegel Harbor, Sylvan Lake, Birmingham, and 89.5 Avondale Community Radio, serving the fine community of Auburn Hills we were just talking to, and many, many more. I'm Dave Scott. So many people are happy today. Lots of good news. Libraries, retail opening, restaurants opening on Monday. But one group that is still frustrated are salon owners. And our Erica Jones had an opportunity to head out around our area and talk to some of the salon owners, and also files this report.
Recent comments by Governor Gretchen Whitmer have left Michigan salon owners feeling outraged, insulted, and left behind, as many other industries have seen their restrictions lifted. Let's take a look at what some of them have to say.
I just cannot believe a woman who gets her hair done regularly has
Stand
that
by.
point of view when it comes to us.
That issue, but give me a second here.
It is beyond.
You know, this is community radio. I want to get this right, so what we're going to do is we're just going to reset here for a minute because there's just some computer things going on in our studios. I just want to make sure that you are able to hear this entire report thoroughly from Erica. She put a lot of work into it. So if you would allow me to hit a button or two here, do that there, and we're going to get to our guests in a couple of minutes. So let's reset that. And see, if this was NBC, they wouldn't start this over, Tyler. But you know, we're community radio and television, right? So one more time, Erica Jones now with her report.
Recent comments by Governor Gretchen Whitmer have left Michigan salon owners feeling outraged, insulted, and left behind, as many other industries have seen their restrictions lifted. Let's take a look at what some of them have to say.
I just cannot believe a woman who gets her hair done regularly has that point of view when it comes to us as professionals. It is beyond what words. I don't have words for it right now. I'm so angry. I think you have no idea what we are in a community if you think it's that easy to Google a haircut. I mean, I've been a hairdresser for 42 years. I train every year to up my game, to learn how to be better at, up my skill level and up my customer service. That's, as a business, we're a top 200 salon. There's 200 salons across North America that are chosen. We're one. The idea that anybody can Google a haircut and get the same experience as coming into a salon is it's just asinine.
Salon owners feel like their voices are not being heard, and if they are, the government just doesn't care what they have to say.
If you're one of those people that's going to Ohio, I pray that you are doing your part not to bring COVID-19 home, and that if you haven't resorted to that, Google how to do a haircut, or throw your hair in a ponytail or curl it and get through the next couple of weeks, and we can resume some of these things.
Most of my frustration comes from the government. I was part of the subcommittee to put safe regulations in place with Laura that were submitted over 3 weeks ago now, and it hasn't been looked at yet by our governor. So that is infuriating. We put in a lot of time making sure that those regulations and guidelines set are above and beyond keeping people safe. So the fact that they weren't even glanced at yet is insulting. To not give these salon owners and nail techs and massage therapists guidelines to prepare for this and have the proper PPE it's not okay. I mean, the communication, every other state in America has given their people guidelines except Michigan. It's crazy.
One of the biggest frustrations that salon owners are dealing with now is that other industries that require close contact with people are allowed to open. They just don't understand why they are being left out.
I just feel like dentists are back at work and hygienists are back at work, and they are right in your face cleaning teeth now, not just doing emergency things. Doctors are doing mini facials. So I'm just frustrated because I don't get it. And we haven't really gotten, other than the social distancing issue that could be in a salon, I just don't get it. So it is getting to be a little frustrated, and I'm getting bombarded daily with texts and calls from clients, getting very frustrated.
People who work in salons are very social, and they miss being able to interact with their clients in a work environment.
People in the hair industry are social people. They enjoy that human-to-human interaction, and they're very social, and they like the gratification of providing great service to the customers, and to have that turned off one day can be traumatic.
Michigan salon owners are eager to reopen, and it sounds like their doors will be opening up the second they get the okay from Governor Whitmer. Reporting for the Megacast, I'm Erica Jones.
All right, Erica, thank you very much for that fantastic report. And unfortunately, I don't think that our next guest had an opportunity to hear it, but let's welcome him in anyway. And joining us now with the hit of a couple of more buttons here from the, hold on, let's see if I can do this. There we go. Okay. There's an awful lot of buttons here to hit to make all this happen on one computer. Joining us now is Kevin Lent. He is with Safe Salons of Michigan Coalition, and he is a franchise of Salon Studios. And Kevin, there we go.
Hey.
We got you. How you doing? Welcome to the Megacast.
Thanks so much. I appreciate you having me on.
Kevin, I don't think you got a chance. We did everything we could to give you the ability to hear that report.
I heard it.
You heard it.
I got it.
All right, so, well, perfect. So what do you think about what Erica put together?
The technology curve on your own.
Your thoughts after hearing Erica's report?
Dismay. I mean, I'll still say dismay at how the industry is being treated. The governor was on Mojo in the Morning out of Detroit this morning, and one of my compatriots in this effort, the Safe Salons of Michigan Coalition that we formed, had an opportunity to call in and ask her about not only the comments, but about why Michigan is such a significant outlier. Good news is she did apologize to the industry this morning publicly on that show. I hope she does that today at her presser. When that happens, because that, excuse me, as we heard, offended a lot of people. But what still doesn't connect for us in the industry is we're relying on the science. It's about the science. It's not safe for salons. Well, it is safe for salons, and it can be safe for salons, and it is safe for salons in 48 other states now, with New Jersey being the only state that's not open, at least partially. Every state but 6 are open fully. There are 6 states that are open partially. Governors have given, the counties discretion, or they're open but with limited services, et cetera. We are the only state that is either that is closed, doesn't have an open date, and that's it. It's a fact. And she said this morning on Mojo that our contention is not true. Well, it is true. So, that's where the dismay is. If it's about the science, show us the science. Be transparent about the science. That's where the frustration is, and it started to creep in. Is this a vendetta? Is this a retribution against Carl the Barber in Owasso, or the folks that were cutting hair on the state Capitol lawn a few weeks back? That's not this group. I mean, we're trying to do the right thing.
Kevin Lent is with us. He is the franchise owner of or spokesperson of Salon Studios, and the spokesperson for Safe Salons of Michigan Coalition. Do you really think, honestly, that the governor, and this is not a partisan show, I'm probably getting deeper in the weeds than we have through this whole thing on this issue, because I feel for you guys, but do you really honestly think that the governor is paying back your industry for that barber in Owasso?
I don't know. I mean, I can't imagine that. But the thought creeps into the head of almost everyone in the industry that is doing the right thing and staying closed, and there just doesn't seem to be. You heard from one of the folks you interviewed. I sat in on that work group. The work groups were organized at the request of the administration to provide safe return to work protocols and guidelines for respective industries, and collectively that group represented salon owners and cosmetologists and barbers from around the state worked tirelessly over 4 days in conjunction with LARA, which is the state agency that oversees and licenses not only cosmetologists and barbers but the establishments in which they work, and LARA submitted the plan on May 21st. Crickets. I mean, one of the most kind of if your spouse or your partner or whatever, you guys get in an argument, one gives the other the silent treatment. That's probably the most infuriating response you can get from, in any kind of situation. And we've gotten the silent treatment from Lansing since May 21st.
So Kevin Lent from Safe Salons of Michigan Coalition, what do you want? I mean, you said that you've not received any opening date. And it kind of implied a couple of minutes ago, maybe on the Mojo show this morning, the governor said, well, we have given you guys a date. Can you?
No, she didn't say that. She apologized to the industry for her comment about being able to Google a haircut. And
right.
That should carry people over. But she said that our contention wasn't wrong, that there were other states that had that were not. The contention that 49 states were open and Michigan was the only one not open. She said was not factual. And
okay.
So anyway, we want to be open, and we want to be open with the protocols, that we put forth, through Laura, adopted or modified as the case may be. If there are experts in Lansing that feel that there are additional safeguards, necessary to our return to work protocols, we'd welcome that. We modeled those back to work protocols on other states that have returned to work and reopened salons and barbershops and spas and the like, and there haven't been explosive increases in cases in those states. And this and the existing protocols, Dave, the existing sanitation, infection control, hygiene protocols that are required for cosmetologists and barbers to be licensed to begin with are some of the most stringent in the country, already in place in Michigan. So, these are protocols that this industry, which is professionally licensed, has followed for years.
All right, well, we'll keep an eye on the governor. I think, after that radio show, I'm not going to say that our show's having any impact on the governor, but all the communication going on around the state of Michigan on your issue. You're literally, other than the gyms and the movie theaters and just a couple other categories, you're the last. Right, you're the very last industry, and I just I don't think she wants to aggravate all the people of the state of Michigan. I'm sure these are tough decisions, and we're trying to give her the benefit of the doubt here. Have you also tried to do the same through this process?
Well, absolutely. Her job is extremely challenging in the environment that we're in, especially not only the COVID-19, but the the tense environment that we've been in the last week to 10 days around the George Floyd situation, and it's a very tumultuous time in the country. It's a very difficult time to be in governing leadership, and we respect that. We also, expect that, if and as safe protocols are developed and put forth, allowing an industry that has, $1.5 billion impact to the state of Michigan's economy, would be allowed to reopen. And again, we issued a press release a couple of days ago, Dave, about our position in reopening salons. And upon review of the press release before it went out, I asked that the word arbitrary be removed, because it was in reference to the governor's decision seeming to be arbitrary at times. And I didn't like that word because it's subjective and non-factual, I guess. And when I sat in front of the joint committee on COVID-19 response in Lansing, testifying 2 days ago, and almost every other industry that went up and testified in front of the joint committee used the word arbitrary in terms of their interpretation of some of the decisions. So I don't think they're arbitrary, but so I don't know why salons aren't open. And again, I don't know why it's okay for a dentist to clean your teeth or to put on veneers, which are purely elective and cosmetic procedures, and the patient can't have a mask on and they're in with bodily fluids, but it's not okay to cut hair. I'm not sure why it's okay to get a facial at a dermatologist, but not be able to get a facial at a salon. I mean, these things just don't connect for me. Or get a medical massage, but not get a massage. Inherently, they involve the same processes.
Well, to play the devil's advocate for a minute, and I understand, and I believe me, I've said the exact same thing many times in the show. I think there might be some who would say, well, those are all activities conducted by physicians, and I'm going to characterize the opinion. This is not my comment here. I'm going to characterize what people are saying, Kevin, so be careful with what I'm going to say. Oh, those are just hairdressers. What do they know about, taking care of COVID-19? Do you kind of feel that's the opinion out there right now?
Yeah, I don't think so. I think the opinion is overwhelming support of them. And I think the questioning is, do they have, the protocols and procedures in place to protect against the spread of the virus to the best of their ability. I mean, all of us are in a mitigation protocol, right? This is all about mitigation. This is not about prevention because, I don't think anyone understands how to prevent it. It's about mitigating the spread and ensuring that every protocol and procedure, regardless of the industry, is about mitigation. And so, nobody knows the 130 hours of sanitation, infection control, and hygiene curriculum that a licensed cosmetologist or barber has to go through in order to get their license. I mean, I'm certain they don't understand that. I'm certainly they don't understand, that in many salons, if in all of my locations, all of my the professionals that rent studios for me are going to be required to come back with a certification from Barbicide, the industry standard bearer in sanitation in salons and barbershops for almost 100 years. Barbicide. They have an online certification course all around COVID-19. Every single professional that we bring back, into their studios is going to be required to have completed that and display that in their studio. And the protocols we put forth in the guidelines to the state of Michigan build upon those 130 hours of cosmetology, sanitation, infection control, and hygiene training, and add additional safeguards and precautions to help, again, mitigate the spread of the virus. So, as with any industry, I'd put our professionals in cosmetology significantly further ahead than construction, which is back at work.
Kevin, you are an extremely capable advocate on behalf of the salons of Michigan. I appreciate you being here. I wanted to give you this platform. Oakland County now, at least those that are megacasters, they're aware of your position, and we just want to see what's right. So I'm glad you took time. I'm going to send you a copy of Erica's report so you've got it. Feel free to use it in any way. We'll get it to you. It's going to be on YouTube and our website, but I think it characterizes the opinions of your members, and maybe you're going to get helped out a little bit here politically because the governor's got to know she shouldn't have said what she said. So,
we appreciate the apology, and more than anything, I need to figure out how to do that whole margarita growlers thing.
That and the other thing you want to make sure is when the restaurants open up on Monday, go anywhere in Oakland County and say, Dave Scott on the radio said I could come in here and I can order a quarantini. That is the updated version of a martini.
Us poor salon owners, we're so depressed about not being open. We got to be careful about how many quarantinis and margarita growlers we consume until we get open.
Kevin, I look forward to having a quarantini with you as soon as we get through all this. Thank you for your time today.
Thanks, Dave.
All righty. He is Kevin Lent and did a great job from the Safe Salons of Michigan. We're going to take a break. We'll be back in a moment. This is the Megacast.
For Disease Control in Oakland County Health Division encourages households to prepare for the possibility of a coronavirus outbreak in their community. Keep extra items in your house for an extended stay at home. Remember any special food items for babies, the elderly, and pets. Keep non-prescription drugs and other health supplies on hand, such as personal medications, at least 1 month's supply, first aid kits, alcohol-based hand sanitizer, at least 60% alcohol, non-mercury thermometer, and get copies and maintain electronic versions of health records. Talk with family members about how they would be cared for if they got sick and what would be needed to care for them in your home. Learn about the plan at your child's school and your workplace. Discuss sick leave policies and/or telework options for workers who become ill. For more information, go to okgov.com/health or call our Nurse on Call hotline at 1-800-848-5533.
Coronavirus has put us to the test. Now it's time to put it to the test. We've greatly expanded testing in Michigan. So people who think they may have COVID-19 with symptoms like fever, cough, and shortness of breath can get tested. And those without symptoms who work in public can now get tested, as they could carry the virus. Start by calling your healthcare provider or contacting a testing site near you. Learn more at michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
All right, so add that one to the list, Tyler. As soon as we can, and we know it's going to be Monday, we're going to go out and we're going to get a quarantini. I'm going to have breakfast on Monday. So I think I'm going to go to the steakhouse and have my quarantini. It was their idea in the first place, right? It was their idea. And then, let's see, on my schedule, I got a very busy schedule here now, don't I? On my schedule on Monday, we're going to have breakfast in Sylvan Lake live on the radio at the grill, right? And then I got to come by here and do some work. And then after that, we'll head out to the Harbor Steakhouse and have a quarantini. And then the minute that the salons open up, I am in my salon in Royal Oak getting my hair cut. And then we are going to send Erica. We said that, well, do you remember the name of the establishment we said we were going to send her to?
It was Frenchie's Nail Salon.
Frenchie's Nail Salon, and Erica's going to head out there. I think it'll also be great to get out to Great Lakes Crossings and take advantage of the invitation we kind of asked for and received from Gene Jernigan, the president of the Auburn Hills Chamber of Commerce. So it's going to be fun to get out and get out of our studio, put our masks on, and go see what's going on and welcome a lot of these businesses that are going to be opening up. I do kind of need a checkup, too. I don't want to make this whole show all about me, but I haven't been to my doctor, my physician, for a while. A lot of us have not been to our physicians for a while, so we'll have to do that. I don't think I'm going to do that one live on the radio if you don't want.
It's probably violates a few laws.
Well, I don't think so. I mean,
maybe not if it's voluntary. Who knows?
I don't think it would break any laws. It just might be terribly uncomfortable for the host of the show. But joining us now is Dr. Ronald Lederman. He is an orthopedic surgeon and sports medicine doctor at Lederman-Kwartowitz Center for Orthopedics and Sports Medicine. Doctor, welcome back to the Megacast. Good to see you again.
Thank you. Great to see you all again.
It's good to talk to you here, and conditions have improved. People are, I assume, coming back into your office for the elective treatment that was unavailable to them during the first days of the coronavirus.
They are, and if you don't mind, I'd really like to just start off briefly, acknowledging what's going on in this world. On top of this whole coronavirus pandemic, I really want to identify myself as an ally of the Black Lives Matter movement. You know, although I'm a white man of privilege, and I will never understand what it feels like to be a Black person in America, I'm committed to educating myself and trying to be there for all of the people that are in my lives, whether it be, you know, my friends, my neighbors, my colleagues, my employees. And I think it's just critical that we all try and raise a level of awareness and be there for them, if nothing else, just to listen.
Well, in all honesty, Dr. Lederman, I never allow anyone to hijack any of my interviews. In this case, though, I will make an absolute exception. I appreciate what you're saying. Thank you for putting the brakes on the show for a minute and doing that. And I'm with you. You know, I'm with you. We can all do a better job of making sure that we are good citizens in this country and good neighbors. And you know what? This has been an extremely painful time for our country. in the midst of a lot of other pain that we're going through. And, I know good is going to come out of this. And I appreciate you making that front and center in your life. And I think a lot of folks that have been directly impacted by police brutality over the years are appreciative of what you did. You're saying, hey, look, I got my other things to do, but I'm going to make this a priority in my life, and I'm going to make it such a priority. Before I talk to Dave about medical issues, I want to take this opportunity to make sure people know where I stand. Appreciate it, Doc.
Thank you. Thank you so much for that. I heard a quote from Benjamin Franklin, and it just rings so true. Justice will not be served until those who are unaffected are as outraged as those who are. And that's what has been missing. I could never imagine worrying about my kids leaving the house, getting pulled over for a minor traffic violation, fearing for their lives, me fearing for their lives. I can't begin to imagine. So thank you so much for being understanding of that. And I appreciate your stance and position. And that really, that warms my heart. Thank you.
Well, and back at you. And I just want to also just take 30 more seconds and say the obvious, which we have been saying in this show, but it's worth saying the obvious right now, is that these despicable acts that have made our police officers at home mad, because they've come on the show and said, I asked them, hey, how do you feel, Chief Patton, Police Department? How do you feel, Officer this, Officer that, the various police folks we talked to this week, from Troy, from Rochester, from West Bloomfield, from other communities? How do you feel about this? They're mad. They are mad because the training that they have put into their careers, the way they train young officers, everything they do, the community connection that a guy like, Chief Patton in West Bloomfield, who I just happen to know very well, and the other law enforcement officers. How about Chief Craig in Detroit? I mean, what he's done over the last couple of days has been amazing, and you don't do that without being connected to your community. So, I just want to recognize the police officers here as well. So now that we've done all that, Dr. Lederman, people coming back into your office to get the treatments they need?
They are. It's interesting. When we spoke a couple months ago, we never shut down. We stayed open on day one. We went to a skeleton crew like so many other businesses. They laid off so many of their employees. Our initial priority was multiple. Be there for our patients that needed us with urgent orthopedic issues. The safety of our patients and our staff was paramount, and try and create an environment that made our patients feel safe. So when this whole thing started, and when I suggested we set up a screening station outside of our office, we're in the Lakes Medical Center, which is a large medical facility, and we set up a screening station in the lobby where we were taking temperatures of patients, making sure they had masks, making sure they were able to sterilize, having their family members stay in the car if they can. And this was before it was 90 degrees outside. And it's a fine line because you don't want to incite, you don't want panic. You don't want people to panic and get more worried. And that was expressed to me. Well, I don't know, Dr. Lederman, maybe we shouldn't do this. It's kind of, but you know what, we did that. It turned out to be the right thing. Most others that I know are following suit, whether it be a medical practice or a place of business anywhere else. We saw 95% of our patients were not coming in. They were staying home, and we knew a lot of those patients were hurting. So also on day one, we implemented telemedicine. And like so many of my colleagues, were able to help our patients through video conferencing, on the telephone. And some people might think, well, how can you help me if my shoulder, my knee is hurting? How, without touching me, without examining me, without doing the injection? And you can actually give patients advice, behavior modification, things to do to get better, and until they were able to come in.
Dr. Lederman, we've all learned an awful lot of things the past couple of weeks and months as we've found a new way to help people in whatever industries we're in, and you've done a good job. Now, the possibility exists that we may see another peak in the fall, that we may have to go through some of what we've been through. I've asked every physician that I've talked to if you think we're better equipped with the knowledge that we have gained over the past several months to go through this again if we must. Your thoughts?
I do. I believe that if people, and we all have seen it, not everybody is out there wearing masks or social distancing. They're just not. And you can't get everybody to fall in line. But if you get 50% or 75% of the people, that I hope would have a 50 or 75% impact on the positive of any curve that we're going to experience. Plus, we seem to have access to the PPE, all of the equipment, the masks and everything. So I'm hopeful that we are better equipped and it won't be as scary. And we obviously need the better blood tests. We need massive blood tests, blood for immunity purposes, but also the COVID test for anyone and everyone to get it. And then, of course, treatment. We need to get our hands on a treatment, and it's coming.
So it's not in your immediate area of expertise, but you're a very wise man by evidence of this interview so far today. Dr. Ronald Lederman, orthopedic surgeon and sports medicine doctor. We do see on the front page of our major metropolitan papers today that they are fast-tracking the vaccine. You have a lot more knowledge than all of us. Do you believe that?
I do. You have to be careful. You have to weigh that out with fast-tracking something that didn't get tested as rigorously as it may have, and ends up having unintended side effects, or maybe not as effective as we had hoped. My belief is there are some brilliant minds out there working, and they all seem to be working more together than they have in the past, and that's very encouraging to me.
So one orthopedic question, and we got to run along. Dr. Ronald Lederman, orthopedic surgeon, sports medicine doc. So your area of medical expertise, dealing with our knees and our joints and our shoulders and those kind of things, it just seems like, it's a little bit different than a cardiovascular issue, or, if we're having heart problems, it's clearly to all of us a symptom that we need to address immediately. It's people, I tend to put off some of these little pains in our knees and our shoulders and just deal with them because I always think, I've seen my friends go through shoulder surgery, and I wonder if the cure is worse than the symptom. Do you get that? Do you have any thoughts for folks that are going through that?
Absolutely, and I'm so glad you brought that up. That brings up a really important point that I think distinguishes myself and my doctors, Dr. Kwartowitz, Dr. O'Keefe, Dr. Hyman. At Lederman-Kwartowitz Orthopedics, we focus on non-surgical treatment to get people better. And a lot of people think that if they go to an orthopedic surgeon's office, that they're going to end up having surgery. They're afraid of coming in. They put it off. They live with their pain. It affects their quality of life. It often affects their ability to get out and move, walk, bicycle, exercise. They gain weight, and it's that whole vicious cycle. So all I would say is this. At Lederman-Kwartowitz Orthopedics, we focus on non-surgical treatment. We are on the cutting edge of stem cell therapy, stem cell regenerative therapies, laser treatments. We get 90% of our patients better without surgery. So I would say to everyone out there who's now trying to get outside, release some of this pent-up energy from being cooped up for 3 months, if you have any issues, any concerns, don't be afraid to come to us or call us, because it doesn't mean you're going to need surgery. If anything, on the contrary, we do everything in our power to keep our patients out of the operating room. Our patients seem to really appreciate it.
All right, well, it's been good to talk to you again today, and through this entire crisis, we look forward to keeping in touch with you, and you're our new orthopedic friend. So thank you very much for being with us. He is Dr. Ronald Lederman. Even though I want to say Lederman, it's Dr. Ronald. I'm sure I'm not the only one. Dr. Ronald Lederman joining us, orthopedic surgeon, sports medicine doctor. Good to have you with us in the program. And thank you very much again for your initial thoughts during the interview today.
Thank you.
All right. We're going to take a break. We'll be back in a minute. A lot to wrap up. Wow. What a program today has been. I got to say, I think the most fascinating, if I can say my own show is fascinating, our own show, Tyler, that I think we've done so far. We'll be back in a minute and wrap it all up.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
We know that we're asking Americans to do a lot right now. So we're asking everyone to be selfless for others so that we can protect those who are most susceptible to this virus.
A question I often get asked is, why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
Social distancing is really physical separation of people.
It's what we refer to when we ask people to stay at least 6 feet apart.
Not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected or infect you.
We all have a role to play in preventing person-to-person spread of this disease, which can be deadly for vulnerable groups. For more information on how you can social distance, please go to coronavirus.gov.
I've been broadcasting on the radio since I was 14 years old, and in fact, that started in West Bloomfield as well. And here we are, still in West Bloomfield. I love that. But, Tyler Keefe, in all my years on the radio and doing the other things I've had the pleasure and opportunity to do in my profession, I can't think of a time where we saw so many things that were so vital intersect all at the same time. And I think part of what's going on, if I could do just a little bit of analysis, not editorial, but analysis. If I could do a little bit of analysis right now, I think part of what's going on in our society and culture is the intersection of all these things. And Tyler, we got a lot of things intersecting right now. Let's just start with a very contentious political environment. I mean, that goes without saying, right?
Absolutely.
Okay. And then let's add on to this very contentious political environment a partisan media. That's a new thing. I mean, it's not new in the last year, but over the last decade, just to be clear, I don't think anyone would argue with me that Walter Cronkite would be reporting things differently today than CNN and Fox News.
Absolutely.
All right. So we definitely, without question, polarized media. All right. This darn thing is probably impacted more of all of this, what's going on right now, than anything. There's a camera everywhere. And what's going on this week and this whole George Floyd situation, 10 years ago, 15 years ago, definitely during Walter Cronkite's time, even if it was happening, we wouldn't have seen it. So the fact that everybody has a phone, maybe the biggest hero of the Floyd situation was that kid that actually shot that video in Minneapolis. Okay? Take all that, intersect COVID-19, the governor and the president having a pretty good spat right now, and then, of course, the George Floyd situation. What have I left off the table?
I think that really covers a whole lot of it. And I think, between the pandemic, between the polarization of news, the expansion of media, everyone having access to info and access to communication in the palm of their hands definitely aids to it. And I think it's relations between different sectors of our society that have been at odds from the very beginning, coming to blows again. And now we're faced with, once again, that question of what are we going to do about it, and is it going to be enough?
So much piling on top of each other. It reminds me of that scene in the movie My Cousin Vinny on the porch, if those of you that know that. Right? So it's just so much pounded on top of all of us. So, but I think think what is happening right now wouldn't be the same without all of that all converging at the same time. And I don't think the George Floyd story, I don't think the coronavirus story, I don't think the the Salon story today, and I don't mean to equate these stories from an important standpoint. I don't think what the West Bloomfield Police Department is preparing for protests tomorrow, I don't think any of these stories are the same when you isolate them. But collectively, with everything going on, it is the most fascinating time if you are one that likes to study and watch all this. And it is the most challenging time for us to take all this in, make any sense out of it, share it with our kids, share it with our families, and have any sane dialogue. And I know in my circle of friends, I almost can't talk about these things anymore because people are so polarized. You start having a conversation with somebody, and it gets so dark and so complicated. So that's why it was so nice just a moment ago when Dr. Lederman just said, hey, hold on. Just stop the interview for a minute. I just want to let you know who I am, where I am, what I stand for. I thought that was a beautiful moment. So with that being said, tomorrow will be a big day here on the show. We'll be here at least one of our communities, and maybe we'll find out more before we get on the air tomorrow. Will, as Troy was earlier in the week, we'll be preparing for a protest. And I think we can say now that the good people are winning, Tyler, and that makes me feel really good about what tomorrow is going to look like.
Yeah, it looks like that as of now, and I think the good people that have been at the forefront of this issue from the beginning are getting their voices heard and are speaking with the people, the powers that be, to make that change. And those powers that be are, for the most part, listening. It's only the first step. There's still a lot more to go. By no means is this the problem being solved at this point in time just yet, but it looks like now it's on its way, and we just gotta carry that momentum.
All right. As we have been doing for the past several weeks, I want to wrap up the broadcast today with our COVID-19 vocabulary. Before we get to that, just a couple of program notes. First of all, Monday we will be broadcasting live with the restaurants opening, at least I will, at the Grill Restaurant in Sylvan Lake. We'll be there about 9 o'clock or whenever they open. I think they open at 10, Tyler, if I got my notes correct here.
We'll
okay,
check.
so we'll be there probably a couple of minutes before they open. If you happen to be in the Sylvan Lake area and you want to stop by, I'll buy you. Well, should I say I'll buy you breakfast? There might be a lot of people.
I don't know about that.
I'll buy you a cup of coffee. I'll tell you what, I'll buy anyone who comes to buy a cup of coffee. How about that? That'll be safe. If only a couple of people show up, I'll buy you breakfast. I'll make that decision. But come on by. We'll be there at 10 o'clock at, we'll see what happens. At 10, I'll buy everyone a cup of coffee while I'm there on the air if you want one, all right? And then we'll all get together and we'll celebrate the opening of these restaurants. I want to remind you, too, one other note we did not get to, again, just a West Bloomfield thing. The West Bloomfield Township Hall opens by appointment for people on Monday. We'll talk to the folks there tomorrow, get more details on that, but good news for that. And then we're going to get out to some of these other establishments over the next couple of days, so we invite you to stay tuned. And then for, again, tomorrow's show, we'll be preparing for what's going to be happening in West Bloomfield tomorrow and other communities. And we'll have extended coverage on Lakes FM and Civic Center TV throughout the afternoon. COVID-19 vocabulary, Tyler, we do this to remind people of the things that they need to be doing on a day-to-day basis. We have all flattened the curve, and that's thanks to social distancing.
Yeah, social distancing, keeping a distance of about 6 feet or greater from other people so as to reduce your chances of passing on or picking up the disease.
Important to continue to sing the happy birthday song.
Yes, important to keep singing that for at least 20 seconds. It's about twice over in the entire song to make sure you're getting a good, thorough hand washing.
And even though we have flattened the curve, we are going to be very careful wearing our masks, doing the other things we need to do in an abundance of caution.
Yes, taking extra precautions, being extra safe to make sure that you're preventing yourself from passing on the virus if you're holding it or from picking it up.
The restaurateurs will be handing out a lot of PPE to their employees.
PPE is personal protective equipment. That is face masks, face shields, gloves, gowns, and caps for people that are working in hospital facilities.
As you're doing what you should do during the day, try to use your non-dominant hand.
Yes,
Why?
your non-dominant hand is less likely to be used to scratch your face. You're going to scratch your face with the hand you use for most activities. So if you're opening a door, if you're picking up something off of a surface that you don't normally use, if you're putting your hand on a surface, use your non-dominant hand because you're less likely to touch your face and get coronavirus.
And if you're wearing your mask, which you should be, make sure you avoid FCD, otherwise known as facial covering displacement.
Yeah, you don't want that. If you're wearing your mask incorrectly, it's basically ineffective. It needs to be over your nose and it needs to be over your chin.
Okay, only got a couple of seconds. What is a COVID monster?
COVID monster is being used by restaurants. It's an intimidating stuffed animal put on tables to say, hey, don't sit here. We're social distancing.
And on Monday, we will all be consuming the following brand new drink. It is a Quarantini.
Yeah, Quarantini is a COVID-19 themed martini.
It is. Can't wait to have one. And that's going to be it for the broadcast today. Thank you, Tyler. Thank you to Erica Jones. Did a great job at her report as we took a look at salons. What do you give me a hard time about? I got 10 seconds.
No, nothing.
Okay. All right. Thank you very much. Thanks to Jeff and Ryan and Larry and whoever else I forgot. Great job on the show today. Thanks to all of our stations, Lakes FM, The Biff, WAHS, Avondale Community Radio, and our amazing TV outlets. We will see you bright and early tomorrow morning at 10 o'clock for the Megacast.